want to bring in Dr. Barbara Zins. She's an American pediatrician who has been stuck in Gaza since Friday after arriving for what was supposed to be a week-long mission organized by the Palestine Children's Relief Fund. Doctor, thank you for being with us. You've made it to UN shelter there inside Gaza, but you're still there. What have the last few days been like for you?
Well, first of all, I'd like to say my heart goes out to the Tiferet and her family. We've just been staying in place in safe places, not doing any of our mission work or anything, obviously, and just kind of staying inside, hearing a lot of noises, not seeing a lot, but lots of explosions, sirens, just lots of explosions, drones, things like that.
Have you been in contact with anybody, and how are you working to try to get out? I know right now it's a very difficult and I'm imagining dynamic situation given the lack of power and just the lack of access to so many necessities.
Right. Well, I'm fortunate, unlike the Gazans, but that I've had electricity. I was at a hotel and now I'm at a UN building, and Palestinian Children's Relief Fund has been working and try to get us out. I'm here with another volunteer. We've contacted both embassies. We are working with the Cairo embassy to get Egyptian visas, and actually we were supposed to leave today, except that was the original plan on Monday, but then since the crossing was bombed, there's really no way to get out at this point.
Doctor, and we're showing live pictures of Gaza City as it's about 5:36 in the afternoon, and the bombings have certainly increased just in the last 30 minutes that we've been on the air. Take a look at this, and if you're listening to us on radio, what we're seeing is just the skyline of Gaza, and right in the middle part of it, one after the other, black plumes of smoke emanating from different buildings. Doctor, you've been working closely with doctors in Gaza. Help us understand what it's like there in Gaza when it's not under siege, and what are the people there experiencing now?
Right. So first of all, it's always under siege. It's not as severe of a siege, but it's always under siege. So when I came last year, I went to some of the hospitals and looked at the pediatric units, and then I work with kids with chronic diseases to try to get them medications, funding for some medications that they need. So there's always a medical short supply. The hospitals are always overrun with too many patients and not enough space, not enough medications and supplies. And so they really are running on the brink of disaster on a regular day. People in Gaza have been living with power outages just on a cyclic basis planned for years, really. Right before this started, they were getting 8 hours on, 8 hours off, but I've been here when it's 4 hours on, 8 hours off. And so they really don't ever get 24-hour electricity. Their water system is bad, so they have to use bottled water. And so they're always just barely on the cusp of survival, really.
Doctor, you seem so calm in this moment, and I think if I were in your shoes, I would be in a panic right now. How do you maintain that sense of control and composure, not knowing, really what the future holds in the near future?
Well, I'm fortunate to be an American, right? So I feel like I've have the country on my side to get out. And I really am in a safe place. Before this, we were in a hotel that was very safe. There were a lot of explosions pretty close by, but I would just kind of stay in a safe place and stay away from windows and follow directions that I had.
Yeah.
So I'm just also struck by what Jose was talking about, the idea and what you just described prior to this moment, with how there was an inconsistency in power, how they were already short on food and potable water, and having the medical supplies that you rely on in order to do the work, in order to save people who are going through horrific, health crises. And so now we're, in a position in which Gaza is pretty much isolated more than ever. We know that humanitarian aid is not flowing in. At least that's our latest reporting. The power is even more limited, if power at all, because of fuel not arriving. So what does that mean for the 2 million people who reside in Gaza, all of these innocent civilians?
Well, yeah, I mean, one thing that we know is that half of those 2 million are children. So, and children are more susceptible to dysentery, problems that you get with bad sanitation. Their water purification or whatever there is, that's never working well. And I understand that that might have been hit also. So all of those things affect even a healthy child's health versus even any of these other sick children. So everybody's got a generator, but they now are not getting fuel. So that's not going to last too long. And it's ugly. It's scary. And those people are frightened. They don't have any place to go for safety. They'll go to the UN schools, but sometimes those are not safe places to be. So they really have no safe place to go, and they're going to be running out of food and everything they need in a short time.
Yeah, and there are agencies there on the ground reporting that the schools are full at this point as people are trying to seek a safe place to be. Dr. Barbara Zinn, thank you so much for taking the time and shining some light for all of us, and best of luck in your efforts to get out of Gaza safely. We will be thinking of you. Please keep in touch.
Thank you, Doctor.
Okay. Thank you.